Connected. Okay, Autumn, recording
There you
started.
go. Yay.
Yeah, well, we need more practice here, including myself, that's for sure. Let's have, who had the hand up first? Can I go to Senator Courtney? People okay with that? Go
That's great. Thank you.
2 minutes, please.
I don't need 2 minutes. So I'm Sandra Courtney. I live on Wales Road. Thank you very much for letting me chat for a minute. I'd like to second what Keith said about the inconsistent messaging or lack of messaging from the Board of Health to the community. I have not seen any active communication encouraging our community to take precautions and take this seriously, and I find that incredibly frustrating. I'm also very frustrated by the idea that if there is an issue or a concern, that we are supposed to be contacting the Board of Health. And I don't really know how that would work. Am I supposed to go to the website and look up your phone numbers and then call and leave you a message? So if my next door neighbor's having a rager, I'm going to leave you a voicemail and then maybe you'll get back to them. Like, I don't see how that's an effective way to deal with a pandemic. I think that you guys, are you all right over there? It sounds like somebody's
Hello.
like working a garbage disposal.
Okay,
Mute your phones.
yeah, people would mute their phones, and then turn them on when we get you in the session. Let me ask Autumn,
No,
generally,
I've just got one more thing and then y'all can
Go ahead.
respond however you'd like. I
Yeah,
think that
stay on and listen, I hope. Go ahead.
the decision to make the Board of Health be the enforcement body in our community has not been effective. There is a perception, whether it is right or wrong, that members of the Board of Health do not necessarily believe in the mask mandate. They don't believe that masks are important or effective. There is a perception that that is not a priority to our Board of Health in our community. That is the perception in your community. So you either, one, need to change the perception, or two, change the procedure, because we in our community are having, I am speaking.
Autumn, please.
Hello? Okay, thank you. So we either need to change the perception through you all coming together as a board and speaking clearly and consistently to following the state's guidelines as a board and individually, or you need to change the procedure so that we have either the police department or someone else responsible for.
Okay, we're gonna address that, and I wanna ask, thank you, Sandra, and not that you can't get back, but, hang on, we got a lot of people in the queue. As far as, addressing the Board of Health, of course, there is the local phone number to the office, which Autumn monitors, and I'm gonna ask Autumn just to say a word or two about this, because I have a couple questions myself. The Board of Health can be emailed, and Autumn also monitors us and informs us of what we need to know as we go along between meetings.
Okay, but seriously, an email is not an effective way to respond to an immediate
If
situation.
someone's having a party and the people aren't wearing masks and you can't call because they're over there not wearing masks. There's nothing anyone can do about that. But the thing is, you would be calling if they were making a lot of noise and being loud. So you'd be calling the police. That wouldn't be a mask issue. It would be a noise issue. That's
It's not a mask issue, it's a size issue. It's the state mandate for COVID, which you folks are responsible for responding to complaints relative to the pandemic. If there is an issue with a crowd size, that is supposed to come to the Board of Health, is my understanding. Is that not correct?
Have you seen that happen? What instances have you seen? And I am asking because we haven't had any mask calls going all the way back to June. Things have been quiet. And you're not aware that we have been. I have actively gone around and had conversations. I created a program so that we could have buddies right back in the beginning of all this so that people wouldn't have to leave their homes. And you're thought that I don't believe in masks for
I
whatever.
didn't say anyone in particular. I did not
Hang on.
identify any individual.
Excuse me.
Sandra, hang on.
You do not know why I do not wear a mask. You have never had a conversation with me about why I have not worn a mask. So this isn't really what's got me so upset right now and my heart racing. We had no problem. We were going around. We were handling it, having conversations with people. We were going to businesses and we were having conversations with them, and we were doing it quietly without making a lot of noise, because sometimes making a lot of noise and a big stink doesn't help people's mental issues, which is something that as the Board of Health, we need to be concerned about too. And this mask wearing issue is very heated, hot, and debated, and people are having serious issues with it. We need to take that into concern. Our suicide rates right here in our little town are being affected by this. Concern for that end of the health aspect would also be kind.
So I would just like to clarify that one, did not say anybody in particular. And Mary, I apologize if you feel like you were being singled out. I was not singling you out. I am saying that
my name has been thrown around Facebook as a topic of conversation, talking about my health issues.
Mary, again, I am
conversation that started this, because as I was saying, we never had any issues and we were doing a fine job until I was seen on the opposite side of the street from you, and all of a sudden it's become this terrible issue. It's interfered.
Excuse me, I was not across the street from you. I was not at that protest, and I am not, again, addressing you directly.
Mary got picked up. What I want to do is, we got a lot of people in the queue. We got the message. I have a suggestion also for the board.
So I would just like to finish very quickly, and then I will let
30
go.
seconds.
So, because what is being responded to is not what Mike said. I am not saying that. I am talking about if there is an issue with a business or a residence not complying with the mandates. That doesn't necessarily mean masks. That means crowd size. That means not following whatever safety protocols. Then it does not feel like trying to contact a private individual in their home or by email as an effective way to rectify an immediate situation.
Yeah, I'm going to cut you off right there, and I'm going to address what you've said so far, and let you know what's going on. We're in public session. We have to wrap this up. I'm going to get to everybody. We're going to have short time limit, a negotiable time limit for each person. I see Karen Nolte is the next in line. We're coming. I want to just add that the board, we are doing this public session. We got kind of an open mic thing going here. It's getting a little unwieldy, but I want to let you know that in response to the feedback that I have got from Ingrid and others, it's not on our agenda, but it is in my agenda, and I was going to address just about everything that everyone's talking about at our meeting tonight, if it's before midnight that we can get to it. And it would involve what's our role in enforcement, what's our role in public messaging, how have we been doing. I will get feedback from Maury McCool and our 3 members, and we will address that and incorporate the concerns that each of you have brought and will bring tonight to this public session. And communication is one of them, as Sandra's just pointed out, and she's right. If there's an acute issue that someone's concerned about, such as Ingrid brought to my attention starting 2 weeks ago, there seems maybe we could have a more efficient thing in public messaging to let people know how to alert myself and Mary Holland how we would proceed to address that prior to having the next public meeting. At this point, I'd like to go to Karen. We'll try to hold this to 2 minutes. And so go ahead, Karen, please.
Thank you, Bo, Mary, and Elaine. Caranotti Valley, 230 Stafford Road. And Monson has had an alarming increase, just like every place in America, has had an alarming increase in COVID-19 positive cases over the last couple of weeks, and it shows no sign of letting down. To the contrary, the cases are increasing, and we're going to see a continued surge, probably even more terrible numbers coming out tomorrow than we had last Thursday.
Hold up, Mary, please.
Keith and I have been trying to attend since October 14th, when we brought our initial concern about a Board of Health member not wearing a mask, which was the initial the initial issue that got us to start paying closer attention to all of the Board of Health the mandate and the various enforcement activities and so forth. This has gone so far beyond the original concern, because we started, as Keith mentioned, we started looking at all the meeting minutes and watching all the communications coming out from the town of Monson, theoretically coming from the Board of Health. And we are just very concerned about the inconsistent messages. To echo what other people have said before me, the messages are not strong, the messages are not consistent, and the enforcement's not there. You're not getting complaints because nobody knows to email or call the Board of Health to make a complaint. The Monson Police Department should be designated health agents. We are in a once in a 100-year pandemic. And to think that the three of you can be the primary enforcement for this community is just, in my opinion, is ludicrous, and it's not taking in the public health, the good of the community.
Let me stop you there.
So
One other, yeah, hang on. Okay, thanks, Karen.
Okay.
And this is input is exactly what we're getting from this meeting. I had some before, and these are the issues for us to address. And as I mentioned, I was already on my mental agenda. I'd not put it on the agenda for autumn yet, because it's obvious that we'd be discussing these things. And I appreciate that you, and I think most everyone, realized that a three-member board, you're correct, cannot individually monitor, enforce, and respond to the entire community's concerns on an issue as serious and broad as this. So this is exactly the items that we'll be discussing. You folks, this is an open meeting. We hope to get to our meeting as soon as we get through the public session here. We are in a meeting, but I need to move on to our agenda and address some of these concerns.
Bo, could I just have 30 seconds? I got a little heated there for a second. I just have a couple really quick hit concrete ideas that I just want to put in front of you. Like 20 seconds.
Got other people waiting to speak. Go ahead.
Like 30 seconds. So I want to see expanded communications, better, stronger communications. Evan or whoever put out the town of Monson Thanksgiving information, said mask up, said socially distance, but never once said that the CDC recommendation that you should only be gathering with people within your own household. So I just think that there needs to be better, bigger communication, wider audience, cast a bigger net, and flashing electronic sign on Main Street, banner across town, or whatever needs to be done. But the messages need to be stronger, better, and more publicized. And that's it. Thank you.
We will continue with that discussion continuously as goes on. Okay, thank you. Hold on.
That's all.
I wonder if so far, for what we have at this point, if the rest of you would be just patient for a second, if also in 2 or 3 minutes, if Lori McCool could just give us a little official information that is pertinent to the concerns that have been raised tonight, just in a broad sense anyway, Laura, as to who does what the state does, what we do, and such. Would you be willing to do that, Laurie?
Yeah, sure, no problem. Hi, this is Lori McCool, Board of Health Inspector, and I work for 3 towns. So I work for Hamden, Wilbraham, and Monson, and one of the things that somebody had just recently said is that it is true that the increase in COVID cases is across the board. It is not just Monson that is having this, dynamic increase. Just to give you a little bit of perspective individually for Monson, is that since Halloween, so, end of October, early November, a third of our cases, and now probably just a little bit more than that, have been since then. So we were doing really good up until that kind of end of October, early November timeframe, and that's when things really ballooned as far as our increase in cases. But that wasn't just Monson either. So whatever the dynamics were throughout the state of Massachusetts and elsewhere in the country. But what we have found, and there has been some news. You have probably seen on Western Mass News that they did have Monson, and they talked about our schools being closed for now and the increase in cases. And they interviewed our town administrator and our superintendent. And one of the things, I'm in constant contact with our public health nurse. So our public health nurse is the one that daily reports any additional cases. So she has the information on those cases. She reports the addresses to me. The addresses are given to our first responders so that in the event that they need to respond to a certain address that they are expected to, and they do anyway, is to have the proper protocol for entering a home when there's positive cases. But I would say that in the past couple of weeks, again, there was just a very big increase. And when I spoke with her, because our public health nurse is the one that does all of the follow-ups and the CT, the contacting and the tracing. And sometimes it falls to the state to do that, depending on how many we have in a particular day. But so I asked her the question specifically is, where are we finding, is there a particular focus on where these positive cases are coming from? And she said, honestly, Lori, she said, it's across the board. So we're seeing cases that may be sports related. They may be congregating together. I'm losing my train of thought here, but the social gatherings is a big one. And because what we're able to do is when we're trying to do this contact tracing, and a lot of them are in a home. So if one person in a home contracts it, then it's likely that other people in the home. So there's families that contract it. There's the social gatherings where people are putting together some events. And a lot of times we don't know about these events until after the fact. And then we find out that maybe not everybody was wearing masks. And so if people are gathering, and, again, like I really understand the frustration of everybody with information. And I know that the state puts out a lot of information, and we could probably do certainly a better job of individually putting out information in town. But the whole mask wearing is important, not only for yourself, but as they have said all along, for others. So what you're doing by wearing these masks, even if you're in a gathering with friends, and then with Thanksgiving being here, we're gonna see if there's been clusters that have come around Thanksgiving, and we have Christmas coming up, and we understand that it's important, to see family and be with family, but I think the education as far as what the state has put out and what just nationally has put out with Thanksgiving and the gatherings at Thanksgiving, I mean, that information was every day, all day. So I felt that aspect, just covering the entire nation in a way, was pretty effective, because there was quite a bit of that. But we do need to take on that personal responsibility. And as a board of health and as a health inspector, whenever I do get a complaint from whoever, I investigate the complaint, whether I go personally to the business or I contact the person directly. That's what we've been trying to do. We also have good contact with Karen Fedora, who is our school nurse. And so we have those communications open consistently with the schools, the school nurse. So there is a lot going on under the radar that maybe we don't make available or don't want to put it out there that this is what we're doing. But we have meetings all the time between, me and our public health nurse and the school nurse. The superintendent has contacted me directly on occasions about certain situations. And so we're doing a lot of work that's not really being advertised. But one of the things, and I think what somebody had said, is how do we move forward? And I said we had this conversation with whether or not the police should get involved. The police do get phone calls, and they have been very good about forwarding those phone calls to me. There's been times when things were happening in the fall with people gathering, whether it be for an event or apple picking or whatever it might be. And so I was constantly going into various places to make sure that people were doing the right thing, that the signs were there, and whatnot. So it's not an easy situation by any means, but I just want to let everybody know that as the Board of Health agent, if the calls come into the town, if emails come into the town, and if they do come into the police station, because people do call the police, and the police definitely, contact me, and we have gone out on occasion to various addresses where people may have thought that there was maybe too many people gathering. And so, I think this is a perfect opportunity. I think it's a great meeting. I'm really happy to see the participation with the residents of the town. We need to know how you're feeling, and we want to make sure that what we're doing is going to be best for the town. But do know that Monson is not in itself in this predicament, because it is nationwide, it is Massachusetts wide, and hopefully we'll get through this. Then very quickly, I think it was Peg or somebody that had a question, and I just want to figure now's the time to talk about it, is I have been looking into, again, opening up the books as far as our emergency dispensing site, and opening and getting the books out and figuring out how we're going to do that. I don't even know how many meetings a week that I have with either the DPH and with various, even with our own emergency preparedness team here in Monson. And so we do speak frequently about and getting prepared, because the vaccines may be coming out, and what's that going to look like. We're waiting a lot for information from the state. I'm starting to prepare our emergency dispensing site protocol, because that's going to have, like the schools had to do to open up. They're going to be asking the boards of health to send our protocol and our action plans to the state for their review. But depending on what type of vaccine is going to be coming to us, some of the vaccines require extensive, very deep freeze, and we don't have the ability to do that. Other ones, maybe we can do. Some might allow a drive-through, but other vaccines may require people to be, sit aside, because there may be some reaction, and they want to make sure that everybody's okay before they go home. So we're getting a lot of information. Nothing's been set in stone yet. As you have heard on the news, there are vaccines that are coming out, and they're definitely going to go to those first responders, the hospital people, and those that are in direct contact with patients, and the senior centers, and those types of organizations, and we'll be getting the vaccine, and then it'll start, trickling down to where at some point there will be an opportunity for a public type of inoculation, or whatever the type of vaccine might be. So that's what we have going on right now. Just a brief synopsis of everything. So I'm here. So if anybody has any questions, I'll be happy to answer.
Laurie, could I just yes, thanks. That's on down the road, that's good to public information. The vaccine issue for us is going to be out a little bit, and we'll certainly be involved. But could I just summarize the important points as far as our public session people called in?
Young talk sucks.
You said that hang on there. That the issues coming up are communications, the messaging from the Board of Health, the question of enforcement, and how do these things get communicated amongst the board and ourselves and the rest of the town, and what are we going to do about it? That's what we're talking about here tonight. And I think you've clarified very nicely a few things that a lot of people, and I'd actually forgotten about myself, that in fact the police department is getting calls. They forward that to you and to our office. There's been a tremendous amount of follow-up and monitoring of situations, including gatherings. I'd like to forward tonight, we will be addressing in our regular session here. Mary and I, for instance, will discuss it in a bit so as we get through this phase here. Going out to armadas and discussing what we decide is appropriate to discuss with them, take over place, and we may very well be doing that tomorrow. If not tomorrow, I'll say certainly by Friday. So that's one hot issue that that we would have been addressing anyway at my behest, even if no one had called in tonight, because this is our first public meeting of the board. As I pointed out before, Mayor and I can't go off on our own and say, I think we'll go out and talk to so-and-so about this. The board has to say, and we're going to do that tonight, just what our priorities are and who we're going to speak to. Also, that the communications, you also mentioned, Karen, that the school nurse, she has volunteered. She's busy finishing up her. She was at our last meeting, volunteered her assistant, but she couldn't do it yet because she's finishing up her master's degree work, and that will be just about now. So I will be in touch with her. She didn't answer my last communication about 2 weeks ago, so I left her alone. I knew she was really busy with finishing up her master's degree, and everything else we've all been busy with. So that's my sort of summary of the important points here. I want to see if there's a couple people we can get on, but hang on just a second. Mary, go ahead.
Lori, it's Mary. How many citizens do we have at this time that have tested positive for COVID?
I'm sorry, I don't have that information right in front of me. I was talking to Angela today, and there was I'd have to look it up. I just don't have that right in front of me at the moment. I'm sorry.
What number you had? 39?
Yeah, something like that. And there was an increase, a little bit more than that. As you're talking, I'll look back on my notes.
How many people are hospitalized?
We don't. That's information that's not privy to us. The state through the Maven. If we find out that somebody has been hospitalized, it's only by accident and because somebody that previously, when it first came out, the hospitals used to call the towns if there was somebody in the town that was hospitalized, but they don't do that anymore. And so we don't have the information on whether somebody was hospitalized or that somebody has died. That's not information that comes up on the Maven through the state. So that's, they don't keep track of that per town.
Is that right?
Pardon me?
As far as we know, we haven't had any deaths or hospitalizations.
I don't know that. I can't say that we haven't because that's information that we don't get. So no, that's not correct because we don't have that.
We'll come back
around. Get that information.
Let me move on to, I'm just going to take this, let's see, we got Karen, we got Jeb. Now I got a symbol on here. On my screen, nobody has their hand up. I don't know if I've made them unable to. Bear with me, please. I'll just have to do this randomly, I think. Let me ask the last person that spoke and asked to unmute. I'm not sure I can hear you. I'm sorry. My only identification of this person is 819098. Uh, say something so I can see if I got you here. Now, it says ask, bear with me. What's this one here? Ask to start video. Is, let me just try this. Is Autumn still there? I just want to test out who I got here.
Yes, I'm here.
Oh, okay. So I have to assume everyone else can speak as well. The person who is, all I know is 819098. Would that person say something and see if I can get you audio on here? Not right
They
now.
muted themselves. You can see that it's muted.
Yeah, it says ask to unmute. I just clicked it. Yeah, and thank you. Let's take another one here. How about Isabel Bailey?
Bo, that's Autumn. I don't know.
Okay, I'm gonna hang on. I'll leave you. Hang on. We'll go down here. Who is Kate Carlin? Kate Carlin still there? I got you up on the screen over here. Yeah. Okay. I don't see wave. Anybody else for public session? I'll just throw it out there. And we're going to move on with our.
I'd like, Bo, this is Keith. I'd like to just say a few closing remarks. Yeah. So, you know, just to point out a few things, like to Mary asking those questions, whether we had hospitalizations or any deaths in Monson, I mean, really is irrelevant of what we're trying to do here, which is to slow or stop the spread of the disease in the first place. So that's the most important thing that needs to be stressed. And so I'll echo again, because I don't believe you had us on record when I was speaking before. And the inconsistencies I'd like to point out, I'd like to point out a few tonight, which would be with
this. You've had your 2 minutes. We're ready to move on.
Excuse me, I think you're being pretty rude to someone that is a voting resident of Munson. So I think you should just let me talk.
30 seconds to wrap up. This is the way they do it on talk radio. So go ahead.
Yeah, okay,
Go ahead
thank
and
you.
wrap up, please.
So inconsistencies with tonight's meeting would be before you realized you were being recorded, Bo, you didn't have your mask on, then you put your mask on. And Mary has numerous times in person to my face and on public record, it's recorded that you didn't wear a mask because we live in the United States of America. So, you know, you're spreading a mixed message there as well. And you told me to your face, and I didn't want to bring this up because you keep going there. I will bring it up. You told me to your face that you had a right not to wear it. So you're all being so inconsistent, with the exception of Lori, and she's overwhelmed. So I just want to bring that as the last point of you guys are part of the problem.
You are on record now. That is.
I'm glad I am. So thank you.
Minute. Okay, we're going to move on to agenda. No one else is up. We're moving on to agenda items. How about Laurie McCool updates? I think you gave us a lot of it already. Just is there anything else, Laurie, for us that's current information to impart here to the board?
No, not at the moment, but as the meeting moves on, if there's anything else I come up with, I'll certainly let you know.
I appreciate your hanging in there at the end of every long day that you have there. I had a note here about Karen Fedora and community education. Lo and behold, that's the next agenda item that we've finally gotten there. And I don't know, well, Autumn, do you have anything else to add about agenda item 2?
I do not, Bo.
Yeah, I'm not, that's come up. We've mentioned it. Any other discussion on that? Okay. Next one, review and accept the minutes of October 21st. And, oh yeah, you didn't have, yeah. And as everybody, did you see the minutes?
Yes, I had. I just read that.
And Mary, I make a motion to accept the minutes as written, October 21st, 2020, to accept those minutes as written. Um, second, Mary Hall, all in favor? Aye. Minutes accepted, they will go on the record. Damaged storage container down on Stafford Road. I'm looking back, Keith would enjoy this one, speaking of the record. My own statements and minutes from 2 years ago, which was good to have that Autumn pull these right up for me. And Autumn will speak to this as soon as I get it. This involves damaged trash container, which occurred back it must have been in March of 2019. That was an issue that came up with us and our contracted trash service, Republic, which still is. And we had some dialogue going about that. I remember I went down and examined it. We weren't sure just exactly what caused the damage. So Autumn, can you give us a little update on this?
Sure. So the couple that had called the office about this, I'm guessing that they're not on the call right now. I did let them know that I was going to put them on the agenda so they would have the opportunity to speak to the board. But basically, they called because they were still looking for their container to be replaced in some way, shape, or form. I did speak with Kate, who was the admin back at the time when these meetings were held, and she had said that she did speak with Republic, and they said that they would not be responsible for replacing the container and that there was no proof that they damaged it. So that's all the information that I have. But when the folks called in, they were still looking for someone for us to replace it. And I just, again, let them know that they needed to speak with the board. And they didn't call in this evening.
Hey, anybody on representing the issue on Cedar Swamp Road, damaged trash container?
It would be Rich or Ann.
Yeah, I met with them both down there. I remember the details. The lid was particularly damaged. It had been extremely windy, and everyone admitted that it was impossible to tell whether the wind had whipped the lid back or what. There was some damage on the left front corner. It's a nice, large thing. Someone pointed out at the time, somewhat humorously, that they should have bought a more expensive one. They got it from a cheap supplier, but neither here nor there. I will follow up on this. Autumn, I'm making a note to myself because they'll remember me that I was there. I'll get hold of you separately, Autumn, just to give me the contact information so I can talk to them about that again. Okay?
Okay.
All right, moving on. Excuse me. No. Hauler regulations. We have the items that you left for us as well as the attachments, Autumn. Now, that's the letter of our new letter of November 30th. Has that been sent out or do we still need to approve it?
This letter, this one that I attached, that for number 3 that says hauler regulations are attached.
Yes.
It's the same letter, except it just doesn't have number 3 that has already gone out to all the businesses for the other permits for the restaurants, bakeries, retail stores, and so on and so forth. So the only permits that I have not got out yet are for the haulers, and I believe there's about 4 or 5.
Oh, you know what? Well, first of all, is the November 30th letter attention business owner, you may have just said, but I'm not sure. Has that been sent out or is that yet to go?
Yes, the letter, this has been sent out with all of the permits except for the hauler permits. So I've held off on the hauler permits until you had a chance just to look over everything. This is just paperwork that I found from when Kate had my position. We did last year have a meeting where we started to
I recall.
go over the hauler regulations and then from there, you didn't speak about them after that.
Exactly, the band materials, all the other stuff that want to make sure that they're aware of. Um, the reporting form for the solid waste and recyclables reporting form, because we do require that any hauler have provisions for recycling. Is that correct?
Correct.
And I have the solid waste and recyclable reporting form, the banned materials, and November 30th letter. Let's see what else. I downloaded everything and I picked up the wrong notebook coming to the meeting.
Well, they're all in that folder.
Yeah, those three are there. I'm looking.
There's a paper clip. There was 2 copies of the rules and regulations in the folder.
The rules and regulations are there. Elaine has a copy in front of her. Yeah. Yeah, I just, this is dense and we're not expected to digest every line, immediately. But, and these are the rules and regs town of Monson for removal, transport, and disposal of solid waste or recyclables in our town. And a lot of discussion's gone into the past. Autumn, has there been any change to these regulations to which I just referred recently? When's the last time? I see the date is that they'll take effect on January 1st, 2019, which
Correct.
when we approve them as a board. Has there been any changes or concerns about any of the items in there that you know of?
Not that I'm aware of.
Okay, we have that. Is there something else I might have overlooked here in the packet?
I don't believe so. I'm not sure.
Oh, so should we vote to approve of those forms, paperwork, and the mailing of the November 30th letter to the 5 haulers?
I make a motion.
Yeah. Go ahead, Mary.
I make a motion that we approve the rules and regulations for removal, transport, disposal of solid waste or recyclables in the town of Monson. I second.
And also included in that is the forms, the portable forms, the letter itself, and just to be clear, the letter itself and the list of banned materials. All the haulers will have that, and the solid waste and recyclables reporting form. The motion is on the table. All in favor? Aye. Pass unanimously. Autumn, can I ask you, because the question came up with Elaine about, and clarifying who is a hauler and why are they a hauler? And this, you say there's 5 involved. Obviously, Republic is one of them. Can you tell us the other 4, or just give us an example?
Sure, but if I could just go back just a little bit, I can't hear Mary.
Oh,
So
yeah.
when she made a motion, I couldn't hear any of it.
It was a motion to accept the packet with the hauler materials and the letter is approved by the Board of Health.
Okay.
And the reason, I hear so is when she has her phone on, so she can speak directly, we were getting feedback through this microphone. So, okay, why does this say something about my plug? I just hope I don't run out of power. Hang on, please pick a restart and update the supported version of Windows. Yeah, it's just bothering me with something else. It's still plugged in. I think we're good. Okay, thank you, hauler regs. Let's see, why do we have other haulers permitted in Monson besides Republic?
I don't have a list off the top of my head. I know, I believe we have USA Waste. I don't have a list with me. I wasn't prepared to offer that information.
That's fine. I think these may be people who have their own contracted service.
Yes.
Exactly. Okay, we got it.
Yes. And all are required to offer recycling as well as their trash removal.
Elaine has requested if you could, when you do have a chance, email us list of who they are? Just
Sure.
for our own record?
Yep.
Okay, thank you. Next item, we had correspondence. Peg addressed her own correspondence. The other item of correspondence is, we've all seen it and it's good. And apparently it is a copy of a letter that was sent to the Journal Register, which addresses a lot of what the public session people who joined us tonight were talking about. So that's public information already. So and we're all aware of it. I don't think the author of the letter minds us just mentioned his name. It's Robert Cady of Butler Road, and it's 2 pages long. So we're not we're not going to read it out at the meeting, and it has been sent to the Palmer Journal Register. So that is all of our agenda items. I'd like to introduce, as I was going to anyway, and if Laurie's still on, we can use her input here too and be questions, because since Laurie is the agent in 2 other towns as well, that's just fabulous feedback for us being one town. We're a little less isolated from what the trends are, what other towns are doing, what the feedback is there, and how they're dealing with the details such as we're dealing with right here. I just a short history for anyone else out there might be listening. Back in the spring, we discussed at great length about conferring public health authority to our local police department. That is a matter of state law, that the police department cannot, on their own or as a department or otherwise, go out and enforce what our public health regulations, mandates or otherwise, whether they come from us, the state, or anywhere. That is up to local boards of health to adjudicate that, to decide who is and how to. We had much discussion about that. There were pros and cons. We were in discussion with representatives from the police department at length as well. They attended our meeting, and it was decided amongst all of us that we weren't going to do that time. I think, and I don't think we'll delve deeply into this tonight, but I think we should make an agenda item for our next meeting to revisit that, and that, and not just that, but our own role in enforcement. This is an issue, as Laurie's pointed out to us, and as we're aware, as Board of Health members, is a national issue, and it certainly is in our surrounding towns, and it is in our own town. Governors of the states have come out, New York, Connecticut, Massachusetts. Governor Baker come out and said himself, I just have to say this, and really what it amounts to, it's quote, not word for word, Charlie Baker, this is not really an enforceable issue. There is no means, and everyone knows it. Locally, yes, it is possible that with the right education and approach that our own police department perhaps could help us some. But I think first, Mary and I are going to follow up, as I mentioned, on the one of the primary concerns that come out from many of us, shopping in our town, the places where people are, often my own opinion, but I think everyone would agree, where the highest risk is, where there's a large number of people coming and going. And we have one main place in Monson doing business that way, and we should focus on it. And we're going to address that. And it can't be done in a day or two, but it's a continuous job to do so.
Well, I can kind of like fill in what we're doing now when we do go.
Yeah,
We do bring a packet.
why don't you come over here and
We have our packet
so
where we
everybody
keep,
can hear you.
we bring a large packet with a lot of different information that we discuss with them. We go over the mask, the face covering, facts related to it. We keep a record of every meeting that we have, when we go back, what our follow-up is. So far, everybody that we've dealt with has been really well. I think we haven't had a follow-up call that we had to, they weren't doing what they were told to. We give them guidance on municipalities. We go over any of the common questions about the disease. We coach them on, whenever people are sick. And we give them paperwork on everything, how to be prepared, emergency response paperwork. We discuss, guidance, recommendations. We go over frequently asked questions that they may not know that they had at the time. And then we have extra things, like at the campground, advising on travel, what travel regulations were, going over that with them to make sure they weren't having anybody out of state when they couldn't, whatever the rules were at the time. And we give them safety standards and checklists for indoor and outdoor events. But we do go over a lot, each place that we have gone to is different, and then if anybody has questions without being called on by somebody, it's no problem. I have a ton of packets that I'm able to go in and discuss it with them. And I also leave them with a lot of signage that they can put up around their location so that they have a little more information to share with their customers if it is a store, which it usually has that.
Yeah, thank you for that, Mary. And and we're getting the message tonight. Well taken. We tend to be a little more proactive in that, not necessarily just waiting for a particular situation to develop or someone calls with a complaint. But and communication is the other aspect of the thing I emphasize, and that has been brought up here. And that's another thing we're going to work on. We are working on is how to improve that communication so that we know what's going on. And Elaine has the floor.
Lori, I have a question.
Yep.
Okay. Back earlier in the spring, frequently when people went to a restaurant, they gave their name and their phone number to make it easier for contact tracing. Now that people are eating indoor more in restaurants, is that something we could reinstitute to make it easier for the public health nurse?
Yeah, they should be doing that all along, whether they were eating outside or inside. They should be, all they need is a first name and a contact number for the party that is there to eat. They don't need everybody's name and everybody's phone number. So in the event that there is an issue with somebody have been positive that traces back to a specific restaurant, then they're able to contact those people and let them know. So that's not something that is being reinstituted, it's something that never stopped being instituted.
Oh, because I wasn't aware that was being done local.
Yeah, it's supposed to be, yep.
Okay.
All the guidance that they were given indicates that that's part of what they're to do.
Okay.
Yeah.
Has the public nurse run into problems with that being done, or is it being done the way it should be?
I think it depends on, I think sometimes they're good at it and sometimes they're a little lax at it. It's just, certainly go out when I do my inspections this fall. I'm in the midst of doing some of them to just verify that we don't have a whole lot of sit down places. So it's only those that has sit down seating that would be doing that. So I'll give those couple of places a reminder that, and they only need to keep them for a couple of weeks because that's as long as any contact tracing would go back. However, I could say pretty confidently at this point is that none of the positive cases that we've had so far in Monson were traced back to restaurants. So that's a good thing.
Okay.
And I'd like to recommend again, when this started, I made a recommendation. We had it lined up with Armadas and with the medical corps. I had recommended that we found, we put together big buddies with people in town who couldn't leave their homes. And at the time, no one thought that it was necessary. And I'm just wondering, maybe now if we can bring it up again next week and maybe we'll have some changed minds.
Yeah, I think a good contact for that would be Lori Stacy from the Senior Center, because she would be the one that would know the people that aren't getting out.
Yeah, it was worked out with Adams and with the Corps, because we weren't really going to be active in it. She has people already trained to do that kind of stuff. So it would be more her connecting with Lori to let her know if they had seniors available.
Yeah, and I've been in a couple of meetings with Lori, Stacy as well, and they're really doing a pretty good job as far as all of our seniors and homebound people, being able to get out there and, delivering meals, and they're doing quite a bit along those lines. But if there's, and initially when all this started, we were asked to stay home and we didn't want people to go out. At this point, unless we have another kind of a shutdown, like we did early on, hopefully we won't have to do that again. But yeah, so if there's any information on people that need assistance,
they get harassed, and it just seems like that's why, it was a nice service to start out with, to work on. And I don't understand now, if we're concerned that things are getting worse, why it wouldn't be good to implement now. I don't see that. I alone, even when we didn't do it at the board, I found 5 people that reached out to me that I've been helping out weekly and shopping for. And I have a couple other citizens who do the same thing with me. We have a whole group.
And I had a
good,
couple
that's great.
volunteers to be involved, and then we didn't do it. But and I think there. So let's put that on the agenda for the next meeting, and the idea being that a mechanism we could implement to perhaps mitigate or shut down, prevent the next shutdown from, the idea of what all our attendees, people of the town tonight are emphasizing, be something that can help out there, I think, as well. Can I ask Laurie a question here? Because you're involved with the other towns, I mean, what have you found? What are other towns? How are they handling enforcement? The whole aspect of that, and what do you see? Just sort of an overview, just briefly. What you observe out there, the other towns' feelings about and approaches to the whole area of what's called enforcement.
Yeah, so there's a couple of different avenues. So I get phone calls all the time from the town people, whether it's an employer, an employee, just a citizen with concerns. Most of the complaints, I would say, come directly to me on my cell phone or to the Board of Health, and then it gets transferred to me with the complaint. And then the other way is that the state has a complaint program where you can call in or email in and do whatever, and whether it's Department of Labor Standards or whoever, it goes to, then that complaint comes to me, and then I investigate that complaint. So whether it's, a doctor's office that's not doing something, or a business, whatever the case might be, the complaints are, across the board on, what an individual might feel is something that's being, not being followed as far as all the protocol that the governor has put out. And so then I try to go to the place of business, or go to the, most of them are places of business. So I try to go to them and speak to them personally. And at the same time, one of the things that I try to do as far as educating the public is I let the people know, if they call me personally, I let them know I really appreciate that they're calling, because without them calling, I can't be everywhere 24/7. So it's very important that they reach out, because that's the only way, as the Board of Health, we're going to have the better understanding on what's going on in our town. So first of all, it's,
and probably to Autumn too, why is it that we're hearing you talk about these calls that you're going on, when we were told that that was our responsibility? Did I miss something somewhere? Because Autumn was supposed to be calling Bo and I first and giving us the calls so that you were going to be able to do all of the other things.
I would say that 90% of the calls come to me directly and not through the Board of Health. Places of business call me directly. They don't call the Board of Health. People that call the Board of Health, my number's on there, so they call me directly. So I would say that's probably where most, and then I'm talking about my other 2 towns in general as well, because Bo kind of asked me what I do. My other
having you put something on the Board of Health page that says if you have calls, And we can put our direct emails, and our direct emails go right to our phone, just like a phone call.
And then I think one of the things too, that
Worry about those?
I think initially when this whole first thing came out, it was overwhelming for me as I was handling all 3 towns, and for me to get out and do everything I needed to do for all 3 towns. But now the thing that there has really been a rhythm to how things are going, and there's been this ebb and flow that's been going on. So there hasn't been anything at all that I haven't been able to handle on my own. So I think that might be part of it. And, you know, of course, I think if there's anything that comes along that I feel I can't handle, I would certainly reach out. But I think for the most part, it's been pretty, I've been pretty easily able to handle those calls, especially in Monson, that come to me. And some of it just, it's initiated because of the follow-ups that are be doing with the CTC. So whether it's the public health nurse that's calling me or somebody else, and those kind of contacts are being made to whatever business or what, that's all kept within the realm of,
Lori, you're
pardon
keeping,
me?
Lori, you're keeping logs on those?
No, because those are all private. I'm talking to people that are positive. I'm not going to keep track of positive.
No. I'm talking about any mass calls or anything that you're getting that was supposed to go to us.
Yeah.
We were keeping a log for every call we received and that we went on. That was the protocol, I think, that we were looking at on how we were going to handle it. And I'm wondering if you're filling out the same forms that Bo and I were filling out for those calls.
Gave me the form. I never got a copy of the form.
Okay, are you keeping a notebook somewhere with those calls?
Basic, no, not real specifically, no, because you know, no, I haven't, and on any particular, you know, every single call that I get, because a lot of it's a conversation over the phone.
Well,
and then some,
I understand.
I
think anything like the calls that we go to, any calls like that, I think we need to be aware of those calls that you're going on or what they're for. If we don't know what's going on out there, then we don't know what we're dealing with. Like, I had no idea about this situation at Armadas, you know, I didn't know.
Well, I had no idea about that either. I mean, that was the first.
Well, I'm sorry, look, I'm almost done. So if our communication could just be where maybe you can write those down so that we can be aware of what those calls are, how often they are, and what they're for and all that, so we know what's going on too.
Yep, I'll be very brief and I won't give any names or whatever, but I'm not going to do anything
for that.
positive. I won't do anything with positive cases, because that is definitely something that is strictly with the.
I'm not talking much about
I'm not
positive
gonna
cases as I am people, the calls that you're going to and what they're for, if they're about masks or whatever. See, I don't know what the calls that you're going on are for, and that's what I would just like to know more of.
Well, what Bo was just asking me was, what am I doing in general with all the other towns that I work for? So I'm just trying to inform that as far as what I'm doing with the towns, this is how things are generally being handled with the other towns as well that I work for. So I was just trying to answer Bo's question when it came to how are these calls coming in. So it's a little different for every town, but in general, most of the time, I'd say in Monson, the calls come directly to me, or maybe they go to the police station and come to me on occasion when, and if I'm not able to handle it, I would certainly have called either one of you to let you go handle it. But it hasn't been anything that has been so overwhelming like it was early on, where, you know, we were just getting into all of this and everybody had questions and businesses were trying to reopen. And so that was a whole different ballgame. And now that we were already in, you know, this phase and step that we're in right now, you know, I think most businesses and most people have a pretty good handle on it. So, but I'll certainly keep a log of phone calls that I get, and I'll email all of you to let you know what those are.
Okay, thank you.
Yeah, and we'll check this out. We we can do some of this work without violating the open meeting law of information.
One of the things one of the things, but I want to make sure that you have is that that whatever guidance is given out is the most recent guidance, and not guidance from, and the guidance that we had initially and any packets that we had initially has completely changed. there has been so many updates and so many changes, whether it's with sports, with the, with youth sports, with adult sports, with all of that sort of stuff, with restaurants, with now the indoor dining, back, no more outdoor dining. So all of these types of things are all very specific to the most updated information. So just make sure that whatever's being printed to be handed out is the most recent. I think we're on number 73 as far as updates go. I lose track on that. But so all these updates are every single week we get new updates on, and you can see those on the Mass COVID website, of course, and see what those most recent updates are, and make sure that we're following through with the same guidance on those current updates.
Okay, we're gonna try to wrap this whole thing up pretty soon. I see that Sarah has her hand up. I will give you, Sarah, did you have a question for Laurie? Or can you hold it to a minute? Go ahead.
It's Sandra, and actually, yeah, my only question was, I must have missed it because I saw that Karen Fedora was originally on the agenda, and I heard you mention something, but so that COVID community education piece with Karen Fedora, is that going to be rescheduled, or is that just not happening? Or...
Yeah, I sent her out a text. I didn't want to bother too much because I knew how busy she was, and I'm going to do that by the close of the week, this week, by Friday at the latest. I'll see if I can get her back on the queue. And we had quite a productive and wonderful conversation of the last meeting and the one before, but she said I have to kind of take leave of this right now after introducing all this. But she's got some material, she's got some great ideas, and she's willing to help. And it's a great asset, I think, because she's inside the school department, knows so much about what's going on out there.
Sure.
So yes, that will be forthcoming.
Okay, and just for reference, I didn't recognize there was a new name, and I must have missed that Audra's not on the Board of Health anymore?
No, Audra's taking leave. She's also our assistant treasurer. She has a full-time job there.
Yeah.
We're in touch off and on. She's a fabulous asset because she knows so much about the workings of the town, things that are going on. But she's not on the board at this time. It's Mary and Elaine and myself at this time.
So,
I may be.
hi, Elaine, welcome.
Did you?
Hi, I'm
Did you meet
Elaine
Elaine?
Kurzinski, retired RN.
Hi, Elaine.
Background in adult education as well.
That's great. Awesome. Good to have you on board.
Thank you.
Just surprised I heard the name Elaine. I'm like, who's Elaine? Thank you.
Okay, thank
You're
you. I'm gonna put you on mute. Oh, that's good. We covered a lot of stuff. I think we can add agenda items. We can contact Autumn and continue to, we're allowed to discuss procedural things, that we can form the agenda for the next meeting. Shortly we'll decide when that is going to be, at least tentatively. Any other business from Board of Health members or anything you were up?
No, but agenda items for the next one, definitely.
You want to just suggest a couple right now?
Okay, yeah, we have to work on draft. The contract, we have a 1-year contract.
Let's ask. We won't. Let's not get started now, or you won't get home before midnight.
Right,
But yes, that's been on the table, and since you're a fairly new member, you don't have a lot of the background of this and
sure.
how this got tabled. So we can also talk about that. We don't have to be in a public meeting to provide the information.
Okay.
So let's let me just make a note for you. I will, and with maybe Autumn's help, may not need it. I got just some background so you know where we're coming from, what happened to the current contract and why it's the way it is. And it's kind of in limbo. And yes, we should discuss some more of that. History of and anything else?
No, a lot of it will answer. I was really worried about contract. how that was being handled, but in her, informative
Yes.
presentation, she, covered that, so.
And we'll be covering more of the same. And we can get to that. We don't have to be in a public session meeting to suggest and to share information.
I
How
could just
about
say
that?
one thing, but
Go ahead.
as far as the contact tracing, our public health nurse, Angela Kramer, does a majority of the contact tracing when there is maybe an issue with the school. That information is shared with Karen because she certainly has a handle on names and people, so the contact tracing can also get done through her. And then in the event of other circumstances, it goes to the CTC. And so they have also reached out. The CTC has reached out to communities that are in the red and that may have had more positive cases in recent days, and said that they are certainly available to help mitigate any of the time constraints that's required for the very time-consuming job of contact tracing. So it's getting done, and we're learning a lot. And like I said before, we're learning a lot more about clusters and where some clusters might be coming from. So those are the things that we hope to be part of our additional educational. I spoke with Karen too, probably maybe a few days ago about that educational piece. And one of the difficulties is we're trying to come up with a fresh approach, because we see some of the approaches that have been put forth either by the state or by the CDC have been kind of the same throughout this whole 9 months, and we're hearing it again. But what we're trying to do is to figure out a way that the approach can be more fresh and more specific to Monson, so that we can make more of an impact locally and not just kind of hear that same mantra over and over again, but maybe do it in a way that, so we're looking at a lot of different things. So it's a work in progress.
Okay, I was shocked in the latest data. There were only, in the past 14 days, just over 800 tests that were done in Monson people. I think maybe we need to get out there how available Eastfield Mall is and how quick the test results are back. It doesn't cost people anything. Maybe people don't know that's a resource available to them. Oh, okay. No,
Yes.
I agree, but
And-
I think it's something that maybe we need to get out there.
And actually, I'm a little remiss on that. I had that information, a friend of mine provided for me with the details, and I didn't forward it out to Autumn for an agenda item, or to maybe get it on the website and look at other ways to
Okay.
get that information out about AMR is sponsoring that. I think
Yeah.
it is free. It's been going on for about 3 weeks, or even a little more than that now. So yeah, let's follow up on that.
Autumn, would you be able to put that information on the website?
The information on AMR?
On the
Yeah,
testing,
At
Eastfield Mall.
Yeah, I can do that. If there's something specific other than, I can call AMR tomorrow when I go to the office and, find out specific details to make sure I have everything. And if you have information that you want me to look at as well, that would be helpful.
I'll email. I got a couple of really busy days. I will try to email you what I have, or do a little research on other sides with you. I got it right here. Put a big star on that one. Okay.
I do know that
And
they also,
go ahead, Autumn.
they also
This
do
is what-
have,
Go
they
ahead.
also, they also have, obviously a lot of other test sites, but I was made aware of Urgent Care in Wilbraham, have rapid testing.
Okay, we're gonna research this, and let's not step out too quickly on it and then have to change the information we're putting out there. So let's not
Well,
hurry up, but let's make sure we got our facts straight. I'll be in touch with you, Autumn, about that specifically.
Okay.
one of the things that are available on the Massachusetts website is a list of all of the
I had it
locations of
at 2:00 in the
testing.
morning, and I had the results 8 a.m. this morning.
Wow, yeah.
That's amazing.
One of
Okay,
the things I wanted to mention real quick is that there is a list of all current locations in Massachusetts for testing. And one of the things that I think we have to be careful about is that the PCR test is the one that is the most reliable. The rapid test, if you want to get out of quarantine on that and get tested on that 8th day to get out of quarantine in 10 days instead of 14 days, it has to be a PCR test. It can't be an antigen test,
Yeah.
which is rapid test, because those don't, if you got the rapid test, you
rapid,
have to
all they
PCR.
used to have, that's the standard laboratory technique for infectious disease. It's polymer chain reaction, and it's yeah. And I'd like to look into that because the new techniques and things are coming up all the time. So I'll try to catch up on that technically. But I think we'll focus on what's in our area and how well it could work for us before we jump out ahead of ourselves and start making recommendations that we don't have all the details on. But we'll be working. I've put that at the top of the list right now. Okay, is the board ready to move on to setting the date for the next meeting? Somebody is dinging me. I don't see anything.
Wednesday, December 16th, 6 p.m.
It's been suggested December 16th. That's a Wednesday, I trust. 6 p.m. Motion has been made. Next meeting, December 16th, Wednesday, 6 p.m. All in favor?
Aye.
Aye. One last chance around the board and everybody before we adjourn this meeting. I make a motion to adjourn this Board of Health meeting as of 7:55 p.m. Second the motion?
Second.
All in favor?
Aye.
Meeting adjourned. Thank you, everybody. I think if I just X the thing out. Then meeting